Distal biceps tendon rupture. The anatomy is the biceps brachii muscle and the distal tendon, which inserts at the radius. Right there. The pathology is sharp pain in the anterior forearm following a sudden extension of a flexed elbow. When there can be an audible pop on the affected arm when the injury happens, there will be pain during resisted flexion and supination, swelling around the elbow joint, and tenderness at the superior distal biceps tendon, and a visual bump can form at the biceps muscle, which is the Popeyes, called the Popeyes muscle, where the muscle looks like Popeye, little cartoon. The mechanism of injury is an unanticipated loading of the tendon while the biceps is contracting, but instead the forearm gets pushed in the opposite direction, causes lots of stress right at that tendon, and it can rupture. Signs and symptoms are swelling and bruising around the elbow, difficulty twisting the forearm, difficulty bending the elbow, a bulge in the upper, like at the biceps muscle, sudden elbow pain after the injury, and there will be a snapping or a pop when the injury happens. The special tests are the Hooks test, the bicep squeeze test, and the supination pronation test. This one is the Hook test. Well,
proposed the Hook test and report a sensitivity and specificity of both 100% in the diagnostic cohort study. Devereux et al. From 2013 could replicate the specificity of 100% but report a slightly lower sensitivity of 81%. While the sample sizes were rather small in both studies at 45 patients each, the sound reference standard and setup plus the findings give it a high clinical value in our opinion. To conduct the test, the patient is either standing or sitting. Then the patient is asked to actively flex the elbow to 90 degrees and to fully supinate the forearm. In case of the right elbow, use your left index finger and try to hook it under the biceps tendon by bringing it in laterally of the antecubital fossa. In a normal tendon, you should be able to hook your finger under the tendon approximately 1 centimeter or even until the distal interphalangeal joint and be able to pull it forward vigorously. If the distal biceps tendon is avulsed, you won't be able to hook your index finger under the tendon, which indicates a positive test. In a second scenario, pain may be elicited when pulling the intact tendon forward, which may suggest a partial tear or other injury of the tendon or sheath. Alright, make sure you check out
the bicep squeeze test,
distal tendon. In their study from 2005, they report a sensitivity of 96%, but specificity cannot reliably be noted due to the small sample of patients with a negative response. The study lacks many methodological items, which is why the clinical value of this test is at least questionable. To conduct the test, the patient will be in sitting position and you're going to stand next to the affected arm. With the forearm resting on the thighs, the elbow is flexed to around 60 to 80 degrees to minimize tension in the brachialis and to isolate the biceps to forearm supination. Proceed by slightly pronating the forearm to place tension on the biceps tendon. Then grasp the muscle with both hands placed at the distal myotendinous junction and the muscle belly and squeeze it firmly. The test is considered positive for a distal biceps tendon rupture if forearm supination cannot be observed. Okay, we suggest you continue by watching our SLEP.
and then there's the supination pronation test, which is more for an acute
biceps tendon ruptures. The Hook test and the biceps squeeze test. Metzman et al. From 2015 argued that these tests may not be suitable in an acute situation due to their provocative nature, which is why they propose the supination pronation test. While they reliably diagnosed complete ruptures in 5 patients as confirmed with MRI and surgical exploration, the test has not been subject of diagnostic accuracy studies, which is why its clinical value remains questionable. To conduct the test, the patient is asked to abduct the arms to 90 degrees. If that is not possible, they may support them on the treatment bench. Then, the patient should flex the arm to around 70 degrees and is instructed to pro and supinate the forearm. The examiner will observe the contours of the biceps, which should move proximally during supination and distally during pronation, as seen in Kai here. It's advised to compare the visual with the unaffected side, and if the contours of the muscle are hard to identify, the muscle belly may be palpated for movement. The test is considered positive for a distal biceps tendon rupture if migration of the biceps during pro and supination is absent. So I mentioned the hook test in the beginning.
Predisposing factors is overuse of the bicep muscle. That just leaves it more prone to being outstretched faster and causing that tendon to rupture. Management and treatment is ice for the initial pain and swelling. You want to immobilize the joint to prevent any further pain, and the only real fix for a full rupture is to reattach it with surgery, and then with that comes the rehab program to start it functioning normal. Referral is to get an MRI to see the degree of rupture, if it's fully torn or just partial, and obviously if it's fully torn you got to get a reattachment surgery. Prevention is to build strength gradually. You don't want to go into the weight room, grab a 600-pound dumbbell, and yeah, that'll snap it right off. You want to avoid doing deadlifts, proper lifting form, and then take breaks to prevent that overuse so your bicep stays functional. There's no mulligan, it's just fixed with surgery. My PICO. The population was a 57-year-old man with distal biceps rupture of the left arm. The intervention was a single anterior surgery with 3 transosseous anchors providing proper tension. The comparison was there was no competing interest for treatment. The outcome was orthopedics should practice using. The outcome was basically saying that orthopedics should use anterior surgery with 3 transosseous anchors because it was the best surgery that they used. And then the time was, the dude was in full return after 16 weeks. And then